All right, Dr. Patel, there's some clinical specific things that we've discussed with TDIC, our risk management team. What advice do you have on the clinical aspects of financially protecting yourself?
So you must document everything. I think that's the number one thing. If you're having an assistant write your notes, if you're using a AI scribe, review your notes. The difference between zero point 0.5 carps and 50 carps is a decimal point and a zero, right? And if you're going fast and continuously documenting something like that wrong, every EMR has the capability to edit notes, but it's going to show a date and timestamp when it was edited. So if you get audited by an insurance company, if there ends up being some sort of lawsuit, even if you didn't do anything wrong, if they pull these records and find that consistently there's edits or the notes are being written a week after treatment because there's a date and timestamp, that becomes an issue. I don't sometimes remember what I did yesterday. How am I going to remember how much anesthetic I used on Matt Nelson 10 days ago? Right. And I've seen cases like this because I was involved with some of the stuff in New York. And so, very important to document everything that you do. You know, a lot of this is definitely trusting your gut. And I will say that case selection is probably one of the hardest but best lessons that you will learn. You don't have to be a hero. You need to treat other people the way you would want to be treated. There's a lot of really good CE out there, but before you're going to start offering a service, especially if it's a specialty service, if you do that, you get held to the same standard that a specialist would get held to. So be careful and be prepared because sometimes the procedure might be not complicated, but managing the complications will be. Okay. So this is a lot about case selection. It's a lot about not being a hero, but really it comes down to treating other people the way you want to be treated. If I have a condition that requires better, more specific care than my PCP can give me, I trust them to send me to that person. So treat other people this way. And I think patients feel it and they understand it. We talk about patient satisfaction and how, you obviously don't want to start creating things like refunds or, you want a satisfied patient because that will lead to better clinical outcomes because they're probably more likely to be compliant, but also a reduced likelihood that if there's an issue, they're going to go file a lawsuit rather than pick up the phone and call the office. And this is communication, and this is making sure that you are approachable and reachable. So all of our doctors have a unique email address at the office. They are given to their patients, and that is specifically just to email about picking a time to talk because I hate the post-its that people stick on my desk with please
Yeah,
call and they get
me too.
lost anyway. So that's what we've kind of implemented. And then in our practices, everyone that gets a shot gets a phone call at the end of the day. Okay. So now if someone's like, oh gosh, I still feel numb, you've already talked to them. And so you already documented that conversation. So if there ends up being a problem down the line, it doesn't look like patient neglect or that you never followed up. Okay. And obviously, like like we've said, refunds affect your revenue, right? So you want to make sure that you are following up with patients, that you have those communication systems in place. And also reach out to TDIC, right? They have all the forms in the world in probably every language that you could need. I know they do to do informed consent if you need to dismiss a patient, how you do that in a respectful and legal way. This is why you must have a team, right? You must have a financial team. You must have a insurance team behind you, and that's what they're there for.
Yeah, I think a lot of just good decision making too. The calls I get where things got out of control, I can't tell you how many times the doctor's like, I knew I shouldn't have taken that. I knew I shouldn't have worked with that person, or I knew I should have dismissed them. So, like you said, trust your gut. And then just good decision makings around what you're doing in the practice and having good judgment too. Like I had this supervisor, I remember right when I was out of college, my first career job out of college, and the supervisor, we had this work party, and he great mentor, pulled me aside. He's like, Matt, I just want you to know you're fresh out of college, so it's important that you know you can't make your career at this party, but you sure can ruin it. So so just some good advice from the beginning. And I think I hear stories about treating family or friends like people that you just cut the corners on, like with the paperwork or documentation, because you trusted them. And I think that's where people get caught off guard. And then dating employees, just not a good idea. Not a good idea
No.
there's a whole big world out there. You don't have to date from your little pond, right?
Yes. Yeah. Yes, I
Yeah.
like that. You don't have to date from your little pond. Yeah, just be professional, right? You're still the captain of the ship. And even if you're an associate, you are still in charge of your immediate team, your assistants, your hygienist, making sure that your needs are being communicated to the front. So behave in that obviously respectful and approachable way.
Yeah, thank you. Brett, did you want to jump in on anything on this one?
No, I mean, I haven't personally seen too much on that side of things, liabilities and whatnot, which is great. And I've been with our firm for over a decade. We work with uh, 3,000 doctors, and fortunately, there haven't been a lot. I think the main one has been partnership disputes more than anything else in terms of issues that have arisen from like liability standpoints.